Hello and welcome to Uliza Chochote with me, your host, Linda Alela. As we always say that this is an open forum for you to ask all sorts of questions. And today, trust you me, we are going a different route that you will definitely like. Remember 21144 is the number to send your SMSs and ask anything. We base our focus on herbal medicine, which is very, very important and of course on the rise today. So we talk about a particular plant that has been known to very many people, and of course we are talking about moringa. You need to stick around and get to understand the importance of the plant. Well, moringa, native to parts of Africa and Asia, is the sole genus in the flowering plant family Moringaceae. The name is derived from the Malayan word moringa, which refers to M. oleifera. It contains 13 species from tropical and subtropical climates that range in size from tiny herbs to massive trees. The most widely cultivated species is Moringa oleifera, a multi-purpose tree native to the foothills of the Himalayas in northwestern India and cultivated throughout the tropics. M. stenopotella, an African species, is also widely grown, but to a much lesser extent than the M. oleifera. Moringa grows quickly in many types of environments, and of late, it is becoming very popular in Africa, and more so in Kenya. And today on set, I am delighted to have a specialist, like he's called Dr. Willis Wanjala, Executive Director at Makini Herbs Clinic. I'm sure you've all heard of Makini Herbs Clinic, and of course, we have the confidence from these people because they've been there for quite a long time, and trust you me, they've been doing wonders to the lives of people. He is a botanical, he's going to tell us more about botanical medicine, a bit of it, and herbal medicine before we get to the plant of the day. So karibu sana, Dr. Wanjala.
Okay, thank you. Yeah, my name is Wills Wanjala. I'm an Executive Director of Makini Herbal Clinic. We are in partnership with a number of doctors, herbal doctors. Myself, Dr. Isaac Magige, who is now based in Mombasa, Dr. Musa Ayub, who is based in Gara, and I am based in Eldoret, but I still interact with my patients anywhere in Kenya. We also have Dr. Mary Riziki, whom many people must be knowing about. She's our partner, and we still work together. We have separate semi-autonomous offices, but we have circuits countrywide. So we visit patients in different towns around the country and provide medication based on their medical history. All the patients are interviewed by us. They come in and consult. They give us their medical background or their history of their ailments. And then we tailor specific herbal formulations based on their individual problems. So most people expect to walk into Makini and buy a product off the shelf. Unfortunately, we don't do that. Rather fortunately, because we are more specific, we are professional. We don't give you a product, then you walk away, and we don't even know whether you got cured or not. Most of the time, we do not isolate the active molecule on our part. We use the whole plant. That way, we benefit from other substances, trace elements, at times vitamins and metals that may be available in the plant. So we do not destroy what nature has provided, per se. The pharmaceutical industry would want to extract an active molecule which they'll have identified in the lab. So what we practice is phytotherapy. We can also formulate products and pass them on to the consumers as nutraceuticals. That means they have a nutritional benefit and a pharmaceutical benefit. One good thing about our practice, internationally it is called alternative or complementary. That means we are not using herbal medicine exclusively to manage an ailment. And we are not the first stop most of the time for any patient. A patient who visits Makini Herbal Clinic for consultation or further treatment will have gone through conventional medical systems. And so the conventional medical doctors will have done the initial diagnosis, probably a number of times even reviewed after putting them on treatment on a specific regime, and they don't realize that there is tangible improvement. or because at times a patient may even fail to respond to certain conventional medicines. Then at times, the same conventional medics will refer the patients to us because they know how professional we are. So we work together. And this is what I've always wanted to emphasize, that we are not against conventional medicine. We are brothers and sisters. We are partners in healthcare provision. So we get a patient who has been using this medicine, so they give us their medical history. At times they may have been admitted even for surgical reasons, like people with fibroids. So they have gone through ultrasound scans and all that. So we review all those facts, and then from there we see what to provide as complementary or alternative, depending on the stage they are in the ailment, assuming it's cancer or diabetes or hypertension. That's how we come in. So we do not tell our patients to forget about pharmaceutical products, no. We want to know what they are using because we have some knowledge about the pharmaceutical formulations, and we know to what extent they can interact with alternative medicine, so that we do not endanger the life of the patient. And we keep consulting with the professionals, experts in medical imaging, for example, if we need to have a look at, say, liver cirrhosis, an ailment of the liver, which may be caused by alcohol or non-alcoholic. So we need a professional, a radiologist, to tell us what's going on. If it's a lady who is trying to conceive, we'll need to see whether she's actually having ovulatory cycles. So we need ultrasounds to know what's going on. So we depend a lot on modern technology, but we insist that people should focus more on clean botanical medicine, either as complementary or exclusively, because it can also work on its own under certain circumstances.
So I would ask you one very simple question: why the herbal way?
Thank you. Herbal medicine, as a matter of fact, had been neglected for a very long time. But we've been having traditional healers who partly use herbal medicine. Others are actually spirit mediums or something like that. They tend to probably use African religions, as it were. Now, we came in because people had created sort of mystery around herbal medicine, and they were associating it with witchcraft. But we decided to open that up by bringing the latest technology and incorporating experts in the medical sector. We brought in lab technologists, people who have studied analytical chemistry, botanists, and medical doctors and pharmacists, in order to demystify the aspect of traditional medicine. It didn't have to be done by illiterates. As a matter of fact, right now, at the University of Nairobi, we have a department for pharmacognosy, which is a fairly advanced level of phytotherapy or phytochemistry. And so we decided to demystify that by bringing in good quality, clinically tested herbal products, or what you would call botanical medicine, because there was need. I personally found that there was a void in the market for complementary medicine. There was a serious void because there are no professionals per se. Most of the people who were practicing at that time, because I'm talking about 1997, the people I found in this field were people who claimed to have inherited their practice from their forefathers. And I felt that it is not logical to claim to have inherited knowledge. For example, human anatomy, you cannot inherit
that.
You have to go to school. You have to understand what you're doing. You cannot inherit phytochemistry. You cannot inherit human physiology. We need a very clear, and this is where the government needs to come in, to provide a clear regulatory framework for the practice of alternative medicine or complementary medicine. In fact, some conventional doctors wouldn't even like to prefer, or rather to refer to this as alternative. if it is working, if any scientist can actually observe that the medication you provided has an effect on the body to this extent through clinical trials, just call it medicine. It's no longer alternative, which I appreciate.
Okay.
The pharmaceutical industry depends a lot on herbal extracts. I think it's over 30%, probably even close to 40%. Globally, it could be quantified to the tune of $300 billion or something like that. Whatever the international, the global market is for the pharmaceutical industry, just take 30% of that. Close to 30 or maybe 40. It all comes out of herbal medicine.
Emma Machago. I came here, I was having some problem in my stomach, but I came for medication and I think they are working well, so I've come for a checkup.
At Makini Herbal Clinic, we also have a section for teeth whitening for people who are basically victims of fluorosis. The process where probably high intake of fluoride contained in water tends to change the color of your teeth. We can restore the original white color of your teeth until they become sparkling white in search of a Colgate smile. So you're welcome to do teeth whitening at Makini in Nairobi and Eldoret. In Nairobi, we are at Trishul Towers, and in Eldoret, we are at Komora Center. Just as you can see, this gentleman, after this, he'll be smiling very broadly. This is a process that takes just about 20 minutes to half an hour to clean all the teeth, basically. And you don't have to do all the teeth at the same time. You can do a few depending on your pocket strength or the time you may have. You can come in and do 2, 3, 4, 5, any number you may choose to do. It's pretty fast because of her experience. She's doing it pretty fast. And it has no side effects. It is a herbal formulation. Probably the equivalent of this could be from Masai land. You'll notice that people in Kalenjin land or Masai land have very, very nice bright teeth. Apart from, of course, taking a lot of calcium through their milk and stuff, they also have a special herb that they use as a toothbrush. And the ingredients or the phytochemical compounds on those plants are similar to this. So you can easily use that to clean up in no time at all. No side effects, there's no acid, there's no damage to the gum. Everything is perfect. Like you can see, it's fairly comfortable. Yeah, we have medicine for gingivitis, we have medicine for gum disease, and there's medication also that can reduce tooth sensitivity, just herbal extracts, as well as tooth decay.
Sijaona hivyo, juu hata nimestuka sana, juu hiyo nilikuwa nimeachana nayo sasa meno. Nimejaribu mabrush mengi, lakini nimeona ni sawa, hata sikuwa nafikiri kama itaweza kuwa hivyo. Nimepiga brush, lakini brush yenyewe haikuna kitu ilikuwa inanisaidia. Sasa hili ndio nimeona kweli nimesaidika. Hata ukicheka huwezi kucheka sana, unacheka kidogo tu, lakini sasa inaweza hata cheka, sina mambo sasa.
And I'm sure you're so eager, you want to understand what is it about the moringa that you have, maybe you've planted back, in your backyard and everything, and at times you do not know the importance of it. We have a couple of course, herbal medicines. We have the likes of marubaini, you know them. You have the likes of the fai, you know them. We have a couple of them that do great wonders to our health, situations each and every day. But today like I said earlier on, we are going to focus on moringa. And Dr. right here is going to tell us more about this, the benefits, a little bit about the benefits and everything, the importance of it, what it can cure, what it can maintain, what it can do. And of course, I'm sure we are definitely eager to get to hear about that. So a brief history about this particular plant that we are talking about.
Yes, we are talking about moringa aloe vera. Moringa has lately been in the news, especially in Kenya. Moringa is a very, very versatile plant in terms of for medicinal purposes and for nutrition as well.
Wow.
It contains a very good quantity of potassium, which is very useful for our digestive system. Most of the time when you go to a doctor and you're probably experiencing constipation, they may just advise you to take a banana, and because a banana contains potassium and it's very good for the muscle movement of the digestive system. So moringa beats the banana in terms of the quantity of potassium quantity. It contains quite a number of other useful elements like magnesium, selenium, and all those, and they are very, very useful to the body. In terms of medicinal value, it has been confirmed through research. Clinically, it has been clinically tested to have anti-cancer properties. And probably this is what has encouraged many people to look at it. It has been found to be very, very effective in terms of boosting the immune system. Different parts of the plant actually can be used, from the roots, though people have to be very careful when they're using the roots because it can be poisonous if it's not used in the right quantities.
Okay.
The pods have what we call hypoglycemic effects. They are capable of reducing blood sugar for people with diabetes. The leaves are also very useful. The flowers, you can have extracts from the flowers that have antihistamine properties. That means they can suppress allergic reactions and stuff for people who are allergic to almost anything, So it's a very useful, and I think this is why most people have been focusing on it. So you find it is even much cheaper if you can have it domesticated in your own backyard to use it when you have hay fever or stuff like that. So it's a very, very important plant. And I think people are doing a good thing right now to cultivate it in Kenya.
I think I've used moringa before. I was given by my mom. So while I was actually Googling, you know, I'm thinking about moringa, Googling, and then I saw, okay, this is the very same plant that we you know, like
Exactly.
used sometimes back.
You may be seeing it
But
around, but you take it for
I must
granted.
admit that it wasn't an easy road for me after like drinking it. Well, one, I would want you to tell us, how do you use it? You know, sometimes you would dry, there are people who would dry the leaves, you know, and make sure that they are in powder form so that they would like go around taking them. Some people will like boil the leaves and drink the water. Others will, you know, use it in different ways. So how is it specifically supposed to use? For the roots, I'm sure, of course, you will definitely have to boil them. Maybe
Yeah, for the
with
tree,
water.
for the tree, the roots and the barks, they can be ground and then dried up, and then it can either be boiled or you can even encapsulate.
Ooh.
Because right now with modern technology, you can
Yeah,
very
of
easily
course.
convert that to capsules,
Capsules, yeah.
and that's just pure moringa. You can have it even in tablets by mixing with starch, which does not cause any chemical reaction. It does not change the medicinal value of the plant extracts. So you can use starch and convert it into tablets. You can provide it as a powder rather, and make it, let people use it as tea, either from the leaves or from the tree barks. And for the pods, you can just chew them direct. They're not even bitter.
Oh.
If you're using the pods, the sort of seeds.
Seeds, yeah.
You just chew them, and they have a direct impact on whatever issues you have, especially on managing blood sugars. You just chew the pods, maybe three pods or so 3 times a day, depending on your blood sugar levels and stuff like that. But it's very important to continue to monitor blood sugar levels using a glucometer. And that's why we insist on technology in herbal practice and also appropriate knowledge by the practitioners. You have to keep monitoring. You do not give a patient the pods and then tell them, just sit back and relax. It's very easy for their blood sugars either to go too low or to go very high, and that can have other cardiovascular complications and stuff like that.
I want to understand, how does it work, you know, in
That's-
someone's body? If you take, is that normal? Or
That's now when the issue of dosage comes in. In fact, with conventional medical doctors, the problem they have always had with herbalists is how do you determine how much of this should be used. So that is where it's very, very important that you go to an experienced practitioner of botanical medicine, so they can give you the right quantities. And for that purpose, you're using it as a laxative, which of course it has that effect, but you should use it in the right quantity so that it just improves on your bowel movement without irritating the system. Otherwise, at the end of the day, you may even end up with cancer or rather with ulcers or epigastric hyperacidity, where you feel like you've got a lot of acid in the system. So it's important to have appropriate dosage when you're using moringa. It is not supposed to be used by anyone. You don't just pick it and then throw it in the mouth and then say, I am healed. Yeah, that's why it's very, very important that you get it from the right hands and follow the instructions of the herbal practitioner.
We accustomed Africans, should I say Africans or Kenyans, you will take a couple of different leaves from different plants. You'll take mwarobaini, you will take the fai, you will take moringa, and mix them together. Like boil them and take the concoction.
Yes.
Is that okay?
That's a very interesting question. One of the very important aspects of botanical medicine is that different plants may have similar properties against a specific ailment. And when you put them together, maybe 2 or 3, they achieve some sort of synergy, and their performance is better. It's actually magnified.
I almost thought I would say that would be an overdose,
No,
it is better.
No, it's much better. Now, once you've known exactly which plant contains what, in what quantities, then you can know how to mix and what dose to give. Then you actually end up having a product of higher efficacy against a specific ailment. So it's okay. This is just ancient wisdom that herbal practitioners may have had. And that's why when we were talking about formulation of policy on traditional medicine, we indicated very clearly that the people who know these plants through their culture say through ethnobotany, they should not be dismissed just because they don't speak English. They can share that knowledge and let their knowledge be protected by intellectual property, rights.
Right.
Of course, if the act is improved, it has to be revised, because the initial act on intellectual property regarding herbal medicine actually did not exist. They left out herbal knowledge on intellectual property. So that's why there is need for herbal practitioners in Kenya to get together and push for a cleaner and faster policy on traditional medicine.
Well, we need to take a breath. Of course, we'll take a short break, a short video break. We prepared something for you so that you get to understand. Of course, we're talking about moringa, and maybe you don't know it. For us, we always know it when you've seen it. Personally, I had the same experience. I didn't know it was called moringa, but when I saw it, I was like, oh, I know this plant.
Exactly.
So we need you to understand that plant. We need you to know what we are talking about. And of course, it will definitely be of great help to you later on. So stick around. Remember, this is Uliza Chochote. 21144 is the number to send your SMS to and ask anything. Stay tuned.
For moringa leaves, this is how we package it. And when it's in this form, it can be used as a tea in very hot water. So moringa can also be presented. It's actually, in medical terms, it's called presentation. Or it can be presented in tea bags, which is very easy to use. You can use it regularly for nutritional purposes, but when it comes to specific ailments and you probably wish to increase the concentration or the dosage, then what you can do is increase the number of tea bags, or we can also increase the concentration of the moringa provided through other means, like either this or by converting it into even capsules. It is also possible to have it provided in liquid form. You can provide moringa, you can present the moringa to the patient in many different forms, including tablets. Apart from moringa products, we have many. We have a broad variety of herbal extracts. This contains antihistamines. Basically, it's antihistamine for handling digestive or other respiratory issues, including rhinitis, including asthma, and it is presented in a very comfortable way, because you can almost just lick it, just eat it like chocolate, and it's very, very nice. And this particular one is for a topic that most people want to shy away from. It's for erectile dysfunction, but it also has very good properties for boosting sperm count. When one does semen analysis and you find that your sperm count is below 20 million per cubic milliliter of semen, it's very important that you approach us for medication for that purpose. There are times when gentlemen may probably do a semen analysis and you cannot trace any sperm cell. That is called azoospermia, and this medication, in combination with other drugs that are available here, will give you a very good boost on sperm count for purposes of fertility. We have cases of infertility that affects men, and most of the time you find that they are not forthcoming. They're not willing to come out and talk about it. You do not have to feel ashamed about it. It's a medical condition. Anybody can have it. So kindly come and talk to me, Dr. Wanjala, or my colleagues, Dr. Musa, Dr. Magige, in Mombasa. Wherever you are, call us and we'll let you know where you can get our medicine. Yeah, this is for fertility, for female fertility treatment. It's also very good for breaking down fibromyomas or fibroids. This is a combination of, as I'd indicated earlier on, many different herbs, and the purpose of having probably more than even 18 herbs that have similar properties put together is to achieve a synergy that enables the drug to perform very well on different ailments. We've been having cases where people say, how can you say this drug treats A, B, C, D, E, F? In alternative medicine or complementary medicine, that is very possible because of the way it has been formulated. But we also have individual, what we call single herb formulations. For example, moringa or raspberry that have specific properties that can also handle more than one problem. That is very normal in the field of botanical medicine. It shouldn't be rocket science. So this is a broad spectrum formulation. So basically, if you have any health challenges, feel free to consult Makini Herbal Clinic, Dr. Musa Ayub at Trishul Towers, Nairobi head office. I am Dr. Wills Wanjala. I'm based in Eldoret, Komora Center, and Dr. Isaac Magige is on Kenyatta Avenue, Arrow Plaza, Mombasa.
Welcome back. In case you just tuned in, this is Uliza Chochote with me, your host Linda Alela. And remember, we always say that you're free to ask anything that you want. It is an open forum. 21144 is the number to call. Today we base our focus on traditional, or rather herbal medicine, and we particularly talk about a very important plant, that is the moringa plant. And with me on set is Daktari. He's going to tell us more, like Daktari Wanjala. He's been telling us about this particular plant, and you know, he's gone and gone and gone. And for a moment, while I was out on break, I was thinking about Kenyans. I was thinking about Africans. I was thinking about this person who's sick and they're in dire need of getting health, you know. At that time, even if you're told to take what, you will take. Supposing we tell you today that moringa is going to cure your diabetic condition, it's going to cure your ulcers, you know, you will definitely go and drink moringa without even thinking. Well, I want to hear Daktari's take on the fact that, is it good to just like go at your backyard? Like he said, it's good to have it at your backyard and everything. You just go there, you know, take some leaves, go do some concoction and then drink without even prescription, without getting to know the quantities or maybe the amount that you're supposed to take as a person. Daktari.
Yeah, like I said, it's good to domesticate moringa and many other plant species that have medicinal value. But it's a bit risky to leave children, for example, to help themselves whenever they feel they have a stomach upset or something like that. There must be somebody who probably has acquired this knowledge from their forefathers or from their elders, who will guide them on how much they can use and how they can use it. Whether they're supposed to boil or just use hot water. There's a difference between boiling and putting it in hot water. The amount of phytochemical compounds that are extracted will vary. And so depending on the concentrations of the different plant species, you need some guidance. And that's why all conventional medical doctors, like I'd said, are worried about dosage.
Yeah.
So please either consult a qualified herbal practitioner or your parents who may have traditional knowledge on that.
It brings me to another question. Nowadays you will march into buses, and someone tells you this is aloe vera product, this is this product, this is, a product from moringa and everything. It is good for you this, it is good for this, it can help you do this. We have 1 million of them.
Exactly.
I know at that time you're thinking, okay, fine, I would take this and at least I'm sure it is well prescribed. But even still, there are 1 million of them. How do you even get to know that this is the right one or anything? Yeah.
Some of these people have good intentions. They have clean products.
Yeah.
Unfortunately, you do not have an opportunity for follow-up in the event that probably the product doesn't work at all, or it even turns out to be harmful to the person buying. As Makini Herbal Clinic, we have also been victims of con artists who walk into buses and claim they are university students doing research. They have been sent by Makini Herbal Clinic, and they give out, they pass on their own products, which are not in any way connected to us, and they say, this is from Makini, use it according to the following instructions. So when people probably get injuries, they may want to complain to us. We are not party to that. We do not sell our products on the street. We do not sell our products on the buses. We believe that any patient should be accorded respect and privacy to consult. And therefore, we have set up offices where they can consult and be assisted in a good way, instead of being given products from the street without you knowing how you'll catch up with these so-called doctors later on. For
Well, you've had it, so we'll make sure you don't fall prey of these particular products, whereby you will end up causing more harm to yourself than good. So as we get to wind up the show, because time is not on our side, I'll let Daktari give us some last words, tell us something, some advice before we say kwaheri.
Thank you so much for hosting me, and I want to assure the general public that Makini Herbal Clinic is there to provide the best they can ever get in herbal medicine. We are basically the market leaders, and it's advisable that they consult us regularly. May I also appeal to the government to provide very urgently a regulatory framework to avoid people harming themselves with drugs because of not knowing where to go for guidance, or having quacks infiltrate the field. There is need for us to have a proper regulatory system in terms of training, in terms of product formulation, in terms of registration. And I have no problem, we have no hostility at all against conventional doctors. We work with them. But there is need for us to develop the sector of alternative of complementary medicine, so that people can afford it and live a much more natural life instead of using conventional medicine throughout, when they know very well the side effects of issues like damage to the liver or the kidneys and stuff like that. All the medics know the side effects of these drugs.
On our plant of the day, before I forget, is it readily available? Like today, I want to take moringa, and Dr. is in Eldoret. Is it readily available?
It is readily available. We have our head office at Ngara, next to Fig Tree, Trishul Towers. Anybody who is interested in getting the moringa or leifera in whatever form for any specific ailment, we will be able to provide.
Thank you, Senator Daktari. I hope we'll definitely see you some other time, because we say it's an open forum, and our viewers will definitely ask a couple of questions, and of course they would want you to come back sometimes and get to answer their questions. I'm sure it will be a great pleasure for you to come around.
To be my pleasure.
Thank you so much. You've been watching Uliza Chochote with me, your host, Linda Alela. And until next time, have a pleasant time.